Hello everyone. I am myself Dr. Rajesh Gubba. I am the general medicine educator. In this particular session, I'll be discussing the quiz which I have posted on 24th of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So every day I'm posting the quiz on my Telegram channel and on the subsequent day I'm sending the explanation as well. So join my Telegram channel for everyday quiz discussion. So as a part of it, the first question is, a 12-year-old girl with tremors and emotional liability has golden brown discoloration in the descent membrane. The most likely diagnosis is, the options are Fabry's disease, Wilson's disease, glycogen storage disease, acute rheumatic fever. So the very important points here is the young girl, presence of tremors, emotional liability and brownish discoloration in the descent membrane. So the presence of this golden brown discoloration in descent membrane, this is what is called as the KF ring. And where do you come across this KF ring? You come across this KF ring in patients with the Wilson's disease. So in Wilson's disease, what exactly is the problem? The problem is where there is excessive accumulation of copper within the body. Now you need to understand what is the mechanism for the development of the excessive copper accumulation in patients with the Wilson's disease. So Wilson's disease, it is mainly due to mutation of the gene, that is ATP7B gene, that is being mutated, and it is an autosomal recessive type of inheritance. And what exactly is the basic defect here? The basic defect is the reduced incorporation of copper in the ceruloplasmin. Why? Because the ceruloplasmin levels are reduced. So because there is reduced ceruloplasmin, the copper which is present within the liver, it will not be excreted into the circulation. So there will be reduced excretion of the biliary copper. So at one point of time, the copper levels within the liver increases to a maximum limit. At that point, the copper accumulates in the hepatocytes, causing the liver damage. And liver, once it gets saturated with copper, the copper will spill into the plasma. From the plasma, it goes to various organs, resulting in the clinical features of the Wilson's disease. Now, because of the accumulation of copper in the liver, the individual will develop macronodular cirrhosis. So the very important organ which is affected in patients with cirrhosis of liver, in patients with the Wilson's disease is liver, that is macronodular cirrhosis, right? Now, what are the other organs? There is CNS involvement. That CNS involvement will be in the form of the involuntary movements, that is chorea, right? So these patients, they develop extrapyramidal symptoms, and psychiatric manifestations will be there, and that will be in the form of the history of behavioral abnormalities. And what will be the ocular manifestations? The ocular manifestations is the presence of the KF ring. KF ring is what? It is the one where you have golden brown discoloration in the descent membrane of the cornea. And within the eye, you also have the presence of the sunflower cataract, right? So this is another important ocular abnormality. Then the blood manifestations, if you see, these patients with Wilson's, they develop hemolytic anemia, right? They develop hemolytic anemia. So, and it is a 𝐒𝐮𝐻 negative hemolytic anemia. Now, this is what is your descent membrane within the cornea, right? So, which is the golden brown discoloration in the descent membrane of the cornea, which is nothing but your KF ring. Then how will you diagnose this Wilson's disease? Remember, KF ring, it is present in almost 99% of the patients. But what is the gold standard for diagnosis is, the gold standard for the diagnosis is the liver biopsy. So when you do a liver biopsy, that will show you the presence of the copper. So the quantitative copper assay should be done within the liver biopsy. And other investigations are the serum ceruloplasmin levels. The serum ceruloplasmin levels will be reduced. And at the same time, what will happen to 24-hour urinary copper? The 24-hour urinary copper levels will be increased. That is another important investigation in patients with the Wilson's disease. Then what is the drug of choice, or what is the first choice drug in the Wilson's disease? The first choice drug will be zinc, right? And what are the other drugs? The second choice will be trientine. And what will be the copper chelating agent? The copper chelating agent will be D-penicillamine. Okay, so the first choice drug will be zinc, then second choice will be trientine, and then followed by that the D-penicillamine should be given. So this is about your Wilson's disease. Then you see the next question. Which of the following is false regarding the essential tremors? It is commonest movement disorder, manifest as postural or action tremors, treatment is propranolol, frequency is 4 to 6 hertz. So yes, among the various movement disorders, the commonest movement disorder is essential tremors. It will manifest as the postural or action tremors, and the drug of choice will be the propranolol. And what will be the frequency of this essential tremors? It is not 4 to 6 hertz. It is 6 to 10 hertz. That will be the frequency of the essential tremors. Okay, right. Drug of choice will be beta blocker, that is propranolol. Then you see the next question. Bilateral loss of ankle jerk and extensor plantar response is seen in. Now, if you observe here, this bilateral loss of ankle jerk, this will be lower motor neuron lesion manifestation, whereas extensor plantar response, it will be the upper motor neuron lesion manifestation. Now you see the options: amyotrophic lateral sclerosis, Friedreich's ataxia, Tabes dorsalis, lead poisoning. So among the options which has been given to you, where is that you will have LMN lesion and as well as UMN lesion is in patients with the Friedreich's ataxia. Now what exactly happens in the Friedreich's ataxia, we will be discussing in the subsequent question. Okay, which of the following regions of the spinal cord is involved first in the Friedreich's ataxia? Dorsal root ganglion, spinal tract, peripheral nerve, cerebellum. Remember, the first important organ which is affected in the Friedreich's ataxia is the dorsal root ganglion. Now, after the dorsal root ganglion, what are the other structural abnormalities? There will be degeneration of the corticospinal tract. There will be degeneration of the posterior columns, right? There will be degeneration of the spinocerebellar tract, right? Degeneration of spinocerebellar tract, and then there will be also degeneration of the peripheral nerves. So now why is that you have the loss of the ankle jerk? Because the peripheral nerve is damaged, so that is the reason why your ankle jerk, right, your ankle jerk is being lost. Right, that will be a lower motor neuron manifestation. And because of degeneration of corticospinal tract, you have the upgoing plantars, which is nothing but your extensor plantar response, which is nothing but your Babinski sign. Now, in these patients with the Friedreich's ataxia, this is also due to gene mutation. And the gene that is being mutated is the frataxin gene mutation. And the another name for Friedreich's ataxia is, this is also called as spinocerebellar ataxia. And on which chromosome you have this frataxin gene? It is present on the chromosome 9. And in India, what is the most common form of spinocerebellar ataxia? In India, the most common form of spinocerebellar ataxia is type 2, whereas all over the world, it is spinocerebellar ataxia type 3. Now, what will be the earliest manifestation? The earliest manifestation in patients with spinocerebellar ataxia or Friedreich's ataxia is the ataxia. And apart from that, you will have all the features of the cerebellar involvement. So you will have cerebellar signs like Romberg sign will be positive, dysmetria will be there, dysarthria will be there, and then nystagmus will be there. Now, apart from this, what are the associated features in patients with the Friedreich's ataxia? The associated features will be in the form of, this is called as the pes cavus, right, where there is exaggeration of the arch of the foot. Then the next important manifestation, there will be forward and lateral bending of the spine. So that we call it as kyphoscoliosis, right? That is another manifestation. These patients, they also develop cardiomyopathy, that is the dilated cardiomyopathy. And the other manifestations are, these patients also develop diabetes mellitus, and they also have optic atrophy. Then followed by that, there will be also development of dementia in these patients with the Friedreich's ataxia. So remember, in Friedreich's ataxia, the earliest structure which is affected is the dorsal root ganglion. And what would be the cause of death in these patients? The cause of death in these patients is the cardiac manifestation, that is the development of the cardiomyopathy, right? So that was about your Friedreich's ataxia. And the next question is, vitamin B12 deficiency can give rise to all of the features except myelopathy, optic atrophy, peripheral neuropathy, myopathy. Remember, vitamin B12 deficiency will cause myelopathy, that is subacute combined degeneration of the spinal cord, where there is degeneration of the posterior columns within the spinal cord, and even there is degeneration of spinothalamic tract within the spinal cord. And there will be also optic atrophy. So the most common cranial nerve which is affected in vitamin B12 deficiency is optic nerve or optic atrophy. And there will be also development of peripheral neuropathy, lower motor neuron manifestation will be there. But remember, myopathy retinopathy, it is not the feature of the vitamin B12 deficiency. So this is about the discussion of the quiz which I have posted on 24th of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So join my Telegram channel for everyday quiz discussion. Thank you very much. See you tomorrow again.